Good morning. I'm honored to be with you, even from afar, on this special day to mark the 10th anniversary of the WHO Framework Convention on Tobacco Control. The Framework Convention Alliance, its board of directors, staff, and nearly 500 member organizations across the globe wish to congratulate the 180 FCTC parties. You have made a commitment to protect present and future generations from the devastating health, social, environmental, and economic consequences of tobacco use and exposure to tobacco smoke. In 2005, when the FCTC came into force, the world's nations united in saying it cannot be business as usual for the tobacco industry. Certainly since 2005, the FCTC has accelerated progress in tobacco control in every region of the world. Several countries have struck at the core of the tobacco industry's business model by banning marketing, including the display of products in stores, by banning the industry's fake corporate social responsibility schemes such as in Mauritius, and requiring plain packaging in Australia. Scores of countries have introduced large graphic warning labels covering up to 85% of packaging, and there have been large tobacco excise increases in countries such as my own, the Philippines. But 10 years later, we need to ask ourselves, are we on track to end the tobacco epidemic and its profoundly negative consequences, not just on the health of individuals, but also on human rights, social development, national economies, and the environment? Have we begun to see a decline or even a slowing of consumption in developing countries? Are the poor smoking or chewing less tobacco? Are the tobacco industry's profits declining? Unfortunately, the number of tobacco users and deaths continues to rise. The tobacco industry, the vector of the epidemic, is not on its knees. The profit of the four biggest tobacco companies was over $36 billion in 2013. Definitely, much more needs to be done. While we've succeeded in convincing health ministries of the importance of tobacco control, other government sectors lag far behind. More governments need to hold the tobacco industry accountable for the devastation caused by its products. And a related issue, implementation of the all-important FCTC Article 5.3, calling for governments to refuse to cooperate with the tobacco industry in formulating health policy, should be a priority for all countries. So while we celebrate the achievement of the past 10 years, to our colleagues in the FCTC Secretariat, in WHO, and in governments everywhere, the FCA wishes you all the best and reassures you that together we will continue to move forward with even firmer resolve to end the tobacco epidemic. It's time to step up our game and to remind the tobacco industry that they should be afraid, very afraid.